Hi, Congressman. Thanks for joining us.
Thanks for having me.
So I want to talk about what's happening in Arizona. Health officials in your state reported 172 new COVID deaths today. That marks the largest single-day toll of its kind, but 78 of those were identified through death certificate matching. Does that mean that there's a backlog in death certificate matching? Do you find that problematic?
Yeah, that's exactly what it means. So of those 78, which is pushing about 45% of the number that was reported today, that could have been from 2 months ago, could have been from 3 months ago, could have been from last week. We simply don't know, and that's one of the problems because Arizona doesn't disaggregate that information, and that's been going on. So 2 or 3 days ago, they reported a -1 for that daily death report. So you're getting it all over, and it makes people wonder, well, how accurate are the numbers and where are they coming from? So that's a real huge problem in analyzing and seeing where you are and developing policy based on that.
Well, and then it brings me to this also something I noticed last Saturday. Health officials in Arizona reported 144 new deaths. That's a record for that day. Those did not include the death certificate matches. So like you said, it might be prompting some confusion. Do you feel that the state is equipped to handle this sort of situation, though, as it becomes increasingly reoccurring?
Yeah, well, it's a problem because when they report it, it's the day of reporting. It's not the day of the death. So that's important. And then when you get with the bed reporting, we're left in the same thing. Are there shortages of beds? Well, don't forget that they announced last week that they're not going to include any of the surge beds that are available now, which are 2,000 for general beds and 641 for ICU beds. So they don't even include those in bed availability now, which would drop the bed usage by 20%. And then they don't disaggregate the number of COVID bed use and show you how that's contextualized. So there's all kinds of problems with the numbers, and you have to really dig around to get the real information.
Yeah, and I do want to note also hospitalizations in Arizona are down right now, so that's also some positive news. I do want to move on to this. So your colleague from Texas, Louis Gohmert's recovering after being diagnosed with COVID. He's asymptomatic. He put out a video saying he feels fine, but he is starting treatment. He was very vocal about not wearing a mask. And then we heard House Speaker Nancy Pelosi just last night announce that she's going to be making it mandatory to wear a face mask in the House. Would you be complying with this new rule?
I will comply where I can. I think it's an edict. It's not. I don't think she had authority, but the Democrats have really tried to give her broad authority to control this place, and I view it as an edict as opposed to a rule that that was adopted by the House. That's unfortunate, but I think we're trying to social distance in my office. We're trying to make sure that we comply with CDC guidelines, and I will do my best to comply as well. But by the same token, I think she has clearly overstepped her bounds.
And finally, Congressman, Ohio Governor Mike DeWine, he put a stop to the Ohio Board of Pharmacy's efforts. I see you nodding your head. You know where I'm going with this. To prevent people from accessing hydroxychloroquine to treat COVID-19. Do you think that was the right move? What's your take on that?
Yeah, I do think that was the right move. So one thing we know about HCQ is that it is a safe drug. It's FDA approved. It's been approved for 70 years or so. It's had literally hundreds of millions of uses, and we know what the side effects are, and the palette of that is very small and can be regulated very carefully. The question, of course, is efficacy. So we know that there's studies, observable studies, where I'll just refer to them as anecdotes, where doctors have put together, and the most recent study out of the hospital out of Detroit, that there seems to be some positive effect on those who take hydroxychloroquine with zinc and a Z-Pak, and that's 50% more were healed than otherwise. On the same token, there's not been the double-blinded super standard test which do that. So the point is, it's safe. Why don't we let patients and doctors be the ones who make the determination on whether they take a regimen of Z-Pak, zinc, and hydroxychloroquine? I think that's the better approach, and I commend the governor of Ohio for doing that.
Right, so ultimately giving the patients and their doctors a choice to decide and not letting some outside group make the choice for them. All right, Congressman Andy Biggs of Arizona speaking with us today about the pandemic and what's happening in his state. Thanks so much for stopping by.
My pleasure. Thanks for having me.